Hello and welcome to our webinar, Taking Control of Your Practice's Care Guidelines in NextGen Enterprise. I'm Grover and I'm the Marketing Manager for DAS Health. Before we get started on today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention this webinar will be recorded and we'll send out a copy of the slides along with the recording within the next week. Next, I want to remind some super exciting news. iTentiv is now part of DAS Health. DAS Health is a leading provider of health IT and management solutions, and a trusted physicians groups, hospitals, and healthcare systems across North America. By combining our skills and expertise, we'll be able to provide even more support, value, and solutions to your practice. We look forward to continuing to serve you. So over the next month, you'll see us transitioning our emails and social media channels to the DAS name. So please, 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 please start following us as DAS Health and keep your eyes out for our new emails. And again, I want to reassure you that we're still here for you. We are still here specializing in NextGen and keeping our focus on you. We're still passionate about providing solutions for healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. We're still going to do everything NextGen, including productivity solutions for NextGen, including ChartGuard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. Next, I want to mention some upcoming webinars. Speaking of our NextGen add-ons, tomorrow we'll be presenting a brief live demo of our NextGen add-on solution that makes the process of creating multiple encounters for a single patient visit more efficient. It's ideal for practices that require billing staff to enter or exit multiple practices in different charges like professional charges, ambulatory surgical charges, anesthesia charges, etc. for a single patient visit. If this sounds like something that might benefit your practice, drop us a note in the webinar questions panel and we'll get you registered. Then in July, we'll be presenting Don't Be Surprised by the No Surprises Act. In it, we'll discuss the new piece of legislation that protects against surprise billing and has many requirements that will impact provider practices just like yours. Also in July, we'll be presenting 2022 changes for the MIPS reporting and what you need to know to be successful under the new program this year. Follow us on LinkedIn for webinar announcements ahead, and of course, we'll also send out an invitation from email a week before those webinars. And again, reminder to follow us on DAS Health and to keep your eyes out for our new email domain. Okay, so back to today's webinar on taking control of your practice's care guidelines in NextGen Enterprise. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Holland Lively is Integrated Healthcare Solutions Analyst, and Lexi DeMarche is the Consultant Development Manager at DAS Health. They're super eager to share their knowledge with you today. So with that, I'll let them get started. Holland, it's all yours.
Thank you, Chelsea, for that wonderful intro, as always. And as Chelsea mentioned, today we're going to be handling and giving you really all the tools that you need to take control of your practice's care guidelines and NextGen Enterprise. So first, let's answer this question. What are care guidelines? Some of you might be familiar with care guidelines, some of you may be curious about them, and some of you may not even know what I'm talking about. That's okay. This feature is one of those that in NextGen, if your practice isn't necessarily familiar with the tool and they haven't used it in the past, it could be and can seem a little bit overwhelming in how to really, understand, implement, train, utilize, update your workflows, all the moving pieces and parts of implementing a new piece into your practice's everyday processes. It could feel daunting, but that's the purpose of today. So we want to take some of that curiosity and turn it into skill that you can take back to your practice to utilize this tool to its maximum capacity. So with all of that being said, Care Guidelines is a tool to help clinical staff in making decisions about certain aspects of their patient's healthcare. So the approach I took in truly understanding Care Guidelines was to think of them as a form of clinical decision support. We know how integral clinical decision support has become and will continue to be in healthcare. So the opportunity to enhance your practice's utilization of any tool that may aid in that process should be exciting. Care guidelines are tracked in intervals of time. So think yearly exams, tests, checks, etc. There's a visible alert to your staff in the form of a bubble, very similar to those buttons that you see in the patient information bar that are going to be visible when care guidelines come due and when it's been met. And when I say staff, I really mean, whoever is accessing that patient's chart in NextGen. So it could be nurses, doctors, intake staff, really whoever is going to be in that place. And I know I said to think yearly exams, tests, checks, but let's take it a step further. Care guidelines could be mammograms, colonoscopies, lipid panels, really anything that can and should be completed on some sort of routine basis can be configured and utilized as a care guideline, or it might already be included as one. So I'm sure the next thing on your mind is, okay, this sounds great. How do I get them to work? And to that I say, they're already incorporated into your core ACE templates, meaning that there is no need for any sort of separate installation of Care Guidelines 2.0, which is just what NextGen is calling Enhanced Care Guidelines that's included out of the box with the 6/2021.1 upgrade. But there are configuration abilities available to your practice, which of course we're going to take a look at today. And as far as access points, you see it really everywhere that you would think, on your intake note, SOAP note, telephone communication template, and that histories, checkout finalized workflow side. And it's most often a link called Care Guidelines. So the last piece of fundamental understanding about care guidelines before we really get into the nitty-gritty today is the fact that there's two types of care guidelines, orderables and recommended care items. Orderables are most easily understood as protocols or something with an associated due date or maybe an associated order. They're going to have a CPT and compendium code associated with them. And then your recommended care items are a little bit less rigid, and they're more often used as a reminder to care providers to review with the patient and manually update the care guidelines if it has been performed. They typically do not have an order associated with them, and there is no due date set on them. Think of these as items such as, advice to quit smoking, maybe medication recommendations, things of that nature. All right, so now that we've covered, the basics, that fundamental understanding, we have a good base knowledge. Let's take a look at the system practice template configurations available to you specific to care guidelines in NextGen. The first place to start is in the care guidelines system practice template. It's accessed the same way any other system practice template is, and they really aren't pulling a fast one on you with the naming convention here. A few things to note that you are seeing in the care guidelines setup window in the screenshot above. First, you have the ability to copy all care guidelines to any selected practice, meaning you can basically mirror everything done in this setup once to however many practices you have in your enterprise. This is a great time-saving feature. We really recommend utilizing that if applicable. Another is the ability to opt out of recommended care guidelines, getting as specific as opting out of meds versus non-med recommended care items. Also, you have the ability to check off auto update. This is an optional feature, but when it's selected, guidelines and their new guideline information, if applicable, are automatically applied to eligible patients, including any patient that has already had the guideline applied and active in their chart. So what this does is it basically takes away the need to manually reapply a guideline if any changes are made in the guideline configurations. Last is a new feature available with the 6/2021.1 upgrade, and that's the ability to enable scanned document types to satisfy guidelines. We're going to take an in-depth look at this feature later on today, but just make a note of that checkbox here at the top of our care guideline setup system practice template. So the next section in that system practice template is the define guideline reasons and auto application panel. So this is where care guidelines can be set up and existing care guidelines can be updated. I want to point out though that several care guidelines come pre-installed, so your practice should technically be reviewing all of these prior to making any changes on configuration, just so you kind of know what's available to you. When and if your practice decides to create a new guideline to auto apply specifically, you're required to select a gender from male, female, or you have the option of O, just the letter O, and that's going to apply the guideline to both female and male patients. And you also, again, for that auto apply, will have to select a diagnosis group. The start and stop age of the guideline setup is optional. And I want to point out that if no start age is entered, the guideline is going to apply to any patient regardless of age. So let's say, for example, you have a patient who's a 45-year-old female, but you have mammograms configured to start at age 50 for female patients. On her care guidelines, you will see the guideline mammogram, but the due date will show as a date 5 years into the future, as the patient is not quite there yet age-wise. So even if the guidelines don't necessarily apply to the patient at that moment, they will still show on the care guidelines view, as they are practice-specific, they're not patient-specific. The next piece of configuration is in the Orderable test setup panel. If you're a little bit more seasoned with NextGen, these used to be referred to as protocols. And this is where you will set up lab tests, diagnostic studies, orders, all of those for a guideline. So when setting these up, your required fields are condition reason, guideline test type, guideline test name, and gender. You have the option to include things such as interval, start age, stop age, Medicare code, and high-risk setting details if you're adding health maintenance item as indicated in the condition reason field. I also want to note that the guideline test code box is going to automatically populate with information as long as it's available based on the guideline test name that is selected from the pick list. So here is kind of a great example of that Orderable test setup panel and everything that goes into configuring those. You can see your different sections here. So the next panel in that system practice template is the test equivalents and alternative section. You're going to see two sections, test equivalents and guideline alternative tests, where users can define additional descriptions and codes for orderable items or protocols, as they once were called, to be used with care guidelines. Basically, this allows you to configure test codes and descriptions that will satisfy care guidelines, but may not be exactly the same as what was originally selected in the guidelines test. The data that's entered in this panel essentially maps the internal test name utilized by your practice to outside descriptions or codes that might be utilized by other practices or other vendors. The test equivalent section specifically is used to indicate different descriptions and or CPT codes for the same test. An example would be hemoglobin A1C and the different naming conventions that might be available for those. You might be actually typing out the long hemoglobin A1C, or you might be using that kind of consolidated acronym, I guess you could call it. They're the exact same tests, and they can be used interchangeably. The guideline test alternatives are different tests that are considered applicable and accepted alternatives to the actual guidelines. So an example for that would be, you can set up a breast MRI to satisfy the guideline for a mammogram. The second to last section of that system practice template is the document types panel. So documents can now be configured to complete a care guideline once scanned in from document management. On that template, you'll select the care guideline and which document types are going to complete the guideline. And I want to point out that you can indicate more than one. So for each document type configured to complete, you're required to fill out the date of service field. And what that does is ensure that the care guideline completed date in the EHR is the date of service rather than the date of that the care guideline was scanned in. Obviously, this is of most importance, since the date of the document is scanned in might not actually be the same date that the care guideline was completed, and we always want to ensure accurate clinical data for your patients. The other piece of this is that checkbox that we talked about very in the beginning here that we need to have selected off. We're going to have that checkbox checked in that very beginning section of our system practice template so that guidelines can be completed by a scanned document. So lastly, on that care guideline system practice template is the FAQ panel. This section allows access to frequently asked questions associated with certain care guidelines. There's a search bar to search specific issues and even the ability to filter, via those little check boxes. You can see them here in that screenshot, so that you're only viewing like maybe FAQs regarding orderables, recommended care items. You also can print displayed information from the FAQ section as long as you have a printer connected to your system and that information is available. So now that we made it through our care guideline system practice template, I'm sure you're all ready to be done with configuration, but alas, we are not. There's just a few more pieces of additional configuration regarding care guidelines that I want to make sure that we point out today. So first is in that system practice template for care guideline setup, you're going to see a link called recommended care. Within that link, you can opt out of your recommended care guidelines, again, both meds and non-meds, basically meaning that you will only see and apply orderables to your patient population if you decide to opt out of those. This is the same exact functionality that we saw in the beginning with that top section of our care guideline system practice template. This is just a different way to access this. The bulk, however, of the recommended care part of the system practice template is the ability to view the recommended care guidelines that are already configured and add, remove, maybe modify recommended care items, as well as associate maybe goals, statuses, and compliance options for their respective recommended care item. I want to note, though, that the recommended care dropdown items you'll see when accessing that template, so maybe you're trying to add a goal or a status, those pick lists are maintained in the custom DB pick list system practice template. So if you want to add a goal and you're not seeing that goal on the DB pick list, your first step is going to be that custom DB pick list system template to configure your dropdown list. So the next system practice template is the care guidelines clear and restore template. Again, not a super creative naming convention, but hey, it does exactly that and it's easy to find. But this template is designed to restore care guidelines to their default values or even clear, reset, or remove existing care guidelines. This must be done in cleanup mode and it should only ever be run after hours. These are all applied at the practice level, so we wouldn't want to do this during operational hours as to avoid changes being made as there are, in real time people charting in patients' charts. So to kind of break this down, let's say that we want to use the clear functionality. Again, this is going to wipe out existing care guidelines, maybe customizations, or out of the box that you have applied to a patient. But let's throw an example out there. So maybe you've applied a diabetes care guideline to the patient population, and that's not something that you're tracking anymore. Or maybe there's a new custom guideline that you want to apply. So rather than deleting them per patient, you can just clear them out of the patient population as a whole. The restore functionality would be to restore all guidelines to their default values. An example for this one is, let's say that you've accidentally completely removed or maybe removed more than you thought from a care guideline. You can go back in and restore them to how they were originally, but the caveat to this is that the removed guideline can only be re-added as long as you're in cleanup mode. So similarly, in the clear and restore template is the report and remove functionality, which allows for removing previously applied care guidelines at the practice level. Also, you have your report and restore. So this is going to re-add previously removed care guidelines. And both of these have export functionalities, which is going to export that report, hence the report in the naming convention of either removed or restored care guidelines. So in these, you can indicate the applying provider, maybe the condition or reason, and or the specific guideline item to filter your report for removal or restoration. And again, both of these must be run in cleanup mode after hours. And that's going to prohibit, any real-time changes to care guidelines, again, as we have potential live documentation going on in the EHR. So there are a couple more features of care guidelines to take a look at. And we're also going to go into workflows, but I am going to go ahead and pass it on to Lexi now to take you through those. So Lexi, go ahead and take it away.
All right, thank you so much, Holland. So hopefully now from Holland's kind of slides that she's gone through so far, you have maybe a little bit better understanding of some, kind of that background configuration that takes place, really to get your practice ready to use care guidelines. So now with that being said, we're going to walk through first, before we get into the true workflow, we're going to talk about some additional functionality that is available for care guidelines. Specifically, this functionality that I'm going to mention in the next couple of slides was made available in the latest release, so that 6/2021.1 release. So a couple things to look forward to if you haven't yet upgraded. So the first is we will see in this new version that we have some new options for care guidelines mapping. So we now have the option to be able to kind of make marking those care guidelines completed even simpler. So we can do this by adding care guidelines to the coded results mapping system practice template. And really what that does is it now allows your practice to designate specific fields on templates that when they are selected or documented on, it's actually going to mark a care guideline item as complete. So, it can be really helpful in the past where, maybe there was only certain out of the box ways that care guidelines could be completed. Like for example, marking maybe in, for tobacco use, if a user goes in and documents something there in the social history panel of the histories template, theoretically, then you would like that to complete if you have a tobacco use care guideline. So that is possible now. And a lot of that is already built into this code of results mapping system practice template. All of those fields that were added out of the box, we will see the letters CG in that code value column. Basically, that just helps you identify that those specific fields are linked to care guidelines. And it really just, again, helps to further, simplify care guidelines, make them easier to autocomplete. So with this template, it's really a good opportunity, like we said, to review alternatives. So if you have a lot of orders that are maybe being placed with names that don't really match up to what's currently mapped out of the box, you can use some of the configuration and alternatives that Holland mentioned previously, along with this template, really for the ultimate goal to make the care guidelines easier to autocomplete. In addition, we'll also see a new functionality with the spring release, and that is a really helpful indicator for lab results. You will see this on the care guidelines window. So it will show you a few things. First, it's going to show you the last completed date. So you can see the last time that this particular lab result was completed for this patient. In addition, you'll see underneath that comments box, you'll see the actual value of that lab result. As well as any flags that are appropriate. So in this example, we have a lipid panel that came back with an abnormal flag. So I can quickly see that with that yellow exclamation point. So this is just really helpful to quickly, as you're looking through, see updates with the lab results. And just as a note, just like any other updates to care guidelines, these can come from either the orders module or also if a historical result was added. And one kind of caveat to this is, we do have our two views, the paged and the grid view, which we'll take a little more in depth here in a second look at. This is only visible on our default page view. Another feature that you will see, in the future if you decide to upgrade, if you've already upgraded, I know is highly, highly requested, but is some ability to have some more control over setting intervals for guidelines. So, prior to the spring release, we were used to seeing our standard intervals, so things such as, every 6 months, 1 year, every 5 years. We might see once to just complete that. So now we'll see some additional options. The first is by calendar year. So when guidelines are marked as complete anytime during that calendar year, so basically anytime between January 1st, December 31st, once that's marked complete, it will then become due again on January 1st of the next year. So what that kind of, removed was previously if it was just every 1 year, even if it was, marked as complete, maybe it was like an annual well visit, marked as complete maybe in December, it wouldn't show back up again until the following December, where maybe it's appropriate that that comes due again on January 1st because it's by calendar year. So that's now an option. We also have the once interval. So, that's just a one-time guideline. Once that's marked as complete, it doesn't automatically come due again unless it's manually re-added. So that can be helpful for maybe just one-off things that you are tracking. for that patient just one time. And then the final option is a seasonal interval. So this is really beneficial. I think probably all can think, things like flu shots, something that really has a seasonal time frame of when it should be due. Obviously, and the recommendations can kind of depend, but really, if we only want that to be due during the time when that would be appropriate, as opposed to all year round, even if it's marked, to be once a year. So basically, we would set those up based on a certain day of the month that it becomes due, and then we put the end of that time frame. So, for example, the influenza vaccine, maybe you have it set in your system from October to March, just for example. So then it will become due on the first day of that month. And then, in that example I just gave, at the end of March, even if the patient hasn't received their flu vaccine, it's no longer, a valid care guideline for that year. So it would fall off and then come back again due the next October. So again, just some options to kind of allow you to control more and really see the guidelines when they apply for that patient. And then the last feature, again, this is a change that would come with an upgrade to the 6/2021.1 release, is some additional functionality regarding UDS and care guidelines. So a new UDS care guideline, so it's labeled CHC/FQHC UDS condition has been added. So really this is to allow you, if you do fall into a category where you are reporting for UDS, or even if you don't report, but you are just, follow a lot of the guidelines of a CHC or an FQHC, this basically allows you kind of a customized checklist of things that typically you are required to, document on for your patient population. So a lot of these guidelines are going to overlap with our general health maintenance guidelines. So if that's the case, then it's always going to look at the most conservative settings. So what I mean by that is, let's say you have a health maintenance guideline for, like a mammogram that is, say, starting at 50 years, and then that's already applied for your patient population. And then the UDS guideline has mammograms starting at 40 years. It's going to only show one guideline for mammogram, and it will be for 40 years because that's the more conservative of the two options. So just so you're aware. So it shouldn't cause duplications, but again, just kind of help you with compliance with that UDS reporting. And as you can see, there's some additional guidelines that were added that are brand new, again, specifically to UDS to help you with that tracking. Okay, so now that we've talked about some kind of new features, some upcoming features, let's take a look at really some of the day-to-day workflows of how you can utilize care guidelines in your practice. All right, so first is, I know Holland already kind of touched on this in the beginning, but just to reiterate, really you can access care guidelines from pretty much anywhere that you are working in the system. So a lot of templates like homepage, intake, SOAP, histories, telephone call template, communication template. Really, the goal is, ultimately that these are configured in a way and used in a way that benefits your practice. We don't want this to become a burden. It should become a tool that's useful. So that's why it's really easily accessible. We have, as Holland mentioned, that red bubble indicator that lets you know the number of care guidelines that are due for this patient. So, in this example, I can see there's 14 due for this patient, so 14 things that potentially need addressed. So it really just, again, hopefully to make it very clear that there's something that needs to be reviewed. We'll see our clinical protocols will show with an interval and our next due date. And then those recommended care items, so again, those are the items not associated with an order. They won't show an interval because they're kind of considered always due. So the next due date is just going to be the current encounter date. So again, those are just to consistently remind users within your practice to either, discuss items with a patient, maybe follow up, maybe if it's a diabetic patient and you want to, ask if they've, how their diet plan is going, if they've had any changes in, vision or swelling in their feet or whatever the case is, you can add those, and then again, just to be able to track those for your patient population. All right, so there really are two ways that you can view care guidelines, and the option that your users decide to use, again, this is on the user level, so they can choose individually. It depends on a few things. It's first what information they're trying to see, and also visually they look pretty different, so it's going to be kind of a little personal preference. NextGen's recommendation is to use this default, which is our page view. And so this is, kind of shows you kind of the most information at one time and gives you a lot of functionality. So we will see when we open our page view, we'll see on the left-hand side, we're going to have a listing of all of the conditions that have been applied for this particular patient. So this is customizable or customized to the patient, so we can just see what applies. In this example, the patient has diabetes, so we have care guidelines specific to that general health maintenance. We've also set up some personalized orderables as well as reminders, so we can see all of that there. And then that left-hand column also serves, we'll see in a few slides, as a sorting functionality. So if I want to hone in just directly on those care guidelines related to diabetes, I have that option. Then we have panels set up. So this is kind of set up to mimic your normal template kind of flow. So we have the first one is obviously the kind of the star of the show, the care guidelines panel. So that's going to show you all of the guidelines that are assigned to this particular patient. With the default view, it is going to show you those that are currently due first. So that's what we're seeing here, all these in red with the yellow exclamation points. We've got quite a few things we would need to address with this patient, as well in some of the later pages, which we can get to with those arrows down at the bottom. It would show us future due as well as completed guidelines, so we can kind of get the whole picture. We would also, if we were to scroll down on this page when we had it open, this window, we have a panel for recent orders. We have a panel for immunizations and a panel for metrics. So we will kind of dive into those panels and what they look like in some later slides. All right, so as I mentioned, there really are two different views. So from that page view, we can click on a link to view the grid view, which is what this screenshot is showing. So obviously it's very visually different. That's the first thing you probably notice. But also some differences with here with this view is this by default just shows you anything that is currently due for the patient. So as I mentioned in the other view, you can see things like, the completed guidelines, if you have any that are, on hold or excluded, we would see those as well. This is kind of a shorter list. It shows you a little less detail for each guideline, but potentially something that, you'd prefer. Some might be a little bit simpler. Just like we saw on the page view, we'll have panels here that kind of mimic our templates. So the first one is our care guidelines themselves, which is what we're seeing in this screenshot. We also will have panels for recent orders, screening questions that are specific to the different conditions. So for example, a set of screening questions for like diabetes. So it'll just kind of prompt you with some kind of maybe points of discussion or things to maybe review with the patient. We'll have those metrics. We'll have a separate panel for vital signs that will show you the vital signs from that current visit. Panel for immunizations, then finally one for nutrition, and then drug therapy. So this, again, is just a different way to view the guidelines, and it's up to each user. You can kind of toggle back and forth, but it will default to that page view for all users. So as I kind of mentioned already, we do have the ability to filter through these guidelines. So they are applied typically initially at the practice level. Then they can be applied, for individual patients as needed. But you might be thinking, especially if you're in a group that is multi-specialty, You know, a diabetes condition might be great, but maybe for yourself as a practitioner, those don't really apply to you. That's not really beneficial. So we do have quite a few options for how we can filter down this list to make it a little more manageable. So as I mentioned, the first is on that left-hand side, where we have the list of the different conditions that are applied for this particular patient. We can select any of those, and it's going to just hone down on those specific guidelines. If we have that selected, if we want to go back to the view of seeing all of them again, we would click that Show All blue link in the top left, and that would take us back to seeing all guidelines applied for this patient again. We also have kind of more on the right-hand side of the window, under that additional field, if we click that blue arrow, we can filter these guidelines by due by. So if we want to, you know, look for a particular date, you know, let's say maybe we're wanting to see all, you know, guidelines that are due by, you know, maybe the date of the patient's appointment that's coming up, maybe next week, let's say. Another really popular filter is due items only. So, you know, this is only going to show us items that are either currently or past due. So again, you know, as you can imagine, if you have a lot of care guidelines, maybe some future ones, you know, maybe this patient is, you know, only 20 years old and they're a female, and your practice has it set up for mammograms to become due, you know, or to start when the patient is, let's say, 50 years old, 40, whatever it may be. That's still going to show in her list just with a future date. So this due items only is just going to take those off the list for right now, obviously. And I should say visually, they're not going to be shown there. They're still obviously on the list. So that's a pretty popular filter. We also have due within. So that's going to show you, you know, any orders due within a certain time frame. So, you know, you can say within certain weeks, you know, months, years. So let's say, you know, maybe for example, you're at a visit, it's a, you know, a well visit, and you want to see, okay, what's going to come up due in the next year. So you can kind of come up with that game plan, or maybe address some things, or, you know, decide maybe we'll address this at the next annual visit, or well visit, whatever it may be. You can use that due within filter. And then finally, we have a filter for order types. So that is going to allow us to filter specifically by our different order types. So that basically means things like lab results, diagnostic tests, things like that. So you can kind of hone in on maybe a specific type of care guideline. So we also have the ability, both from our page and our grid view, to click on a care guidelines history link. So this can be really beneficial, I would say, you know, just to kind of be able to see the past history of guidelines, you know, when they were completed, who completed them, if they were put on hold, you know, if they were deferred, anything like that. We can use that histories link to kind of see some more information. So you can see on the screen here, you know, basically we would just be able to see, you know, what actions were taking place, when that happened, you know, who addressed those guidelines, any comments that maybe were added. So again, just trying to give you some more information regarding the care guidelines and their history. All right, so as I mentioned, there's quite a few panels in addition to just our normal care guidelines panels. And really the purpose of this is to allow you to work within that care guidelines window and really see the information about a patient that you need without having to constantly go out of that window and go into the templates and, you know, start digging. So one of those that is pretty beneficial is the recent orders panel. So this is, you know, you should probably recognize this grid. It's kind of similar to, you know, we see this on some other templates. It basically is showing us all of the orders, so things like labs, diagnostic tests, office services, surgical procedures, and referrals. It shows us both, we can toggle between completed orders and pending. And then we have our links for things like order processing, standing orders. That add button will open up the My Plan by default, but you can go in and you can change that over to be able to place a lab or a diagnostic order or referral like you typically would, you know, through the orders module if that's how your practice does it. So it allows you to view what's been ordered, as well as add or edit any orders as needed without having to leave that window. We also, like I mentioned, have a panel for immunizations. So this is a view-only panel. So unlike with our orders, we can't actually make any changes to immunizations from this view. It really is just showing you can see the status of the immunizations, the date is order, the actual immunization name, sequence number, and date completed. So again, this hopefully will give you maybe some insight if you are looking through, like for example, in this patient, we have an influenza vaccine that was ordered but never administered for whatever reason. That might provide some insight of why that influenza care guideline would still be showing due in that example. We also have a metrics panel. So this metrics panel is specific to the condition set that you have selected. So in this example, we have diabetes selected. So it's going to show you things like lab tests, vital signs, some of that kind of clinical data that would be captured over encounters that maybe would be beneficial when you are really tracking a certain condition. So if before I click on a condition in the top left, you will see it will display as blank. So that's not an error. You just need to select a condition, like I chose diabetes here, for example, and it's showing me their history of the results for hemoglobin A1C, as well as their blood pressure and weight. So you can see each column then is for an encounter, and it would show the results. So again, it kind of allows you to kind of track that over time, especially if maybe based on care guidelines, you're maybe making changes to diet or medication, or ordering additional tests, maybe if that A1C is really fluctuating, whatever the case may be. This will again be customizable to the condition that is selected. All right, so now that we've kind of gotten a lay of the land of the care guidelines window and how that looks, we're going to kind of talk about how care guidelines really function in your system. So there's really two ways that care guidelines can be added for a patient. So the first is them being auto-applied, which is a lot of the configuration that Holland was mentioning in the beginning, is how this auto application works, as well as they can be manually applied. So starting off with auto-applied, like I said, based on the configuration that's done in that system practice template, will determine how these are auto-applied. So as Holland kind of already mentioned, the guidelines can be specific to things like gender, the age, a certain diagnosis code, chronic conditions, problem lists, things like that. And as long as they are configured and then that auto apply is set to Y, and the patient meets that criteria, it will auto apply that condition and those guidelines. So really, this is kind of the gold standard. If your configuration is set up right, then the right guidelines for that patient should be applying. If they aren't, and you find out the next step, where we're going to talk about manually applied, if you have to do that more often than not, I would definitely say look back at your configuration, because this is really the intent, is that a lot of that manual process, which I will admit is probably the biggest complaint if I hear any about care guidelines, really look back at that configuration at those system practice templates. With that being said, there may still be times when you need to manually apply guidelines. So there's a couple of ways that this can be done. The first is on the care guideline window on that pop-up template, there's an add update button. So when you click that, you're going to open up this activate care guidelines template. And basically this will allow you to select the particular condition, which just as a reminder, that conditions like the overarching category of guidelines. And then it will apply, all the specific guidelines that fall under that category. So for example, here we chose CHF, that applies for the patient. And then that would apply all those guidelines that are appropriate, again, based on things like interval, start age, stop age, things like that. We also have the option to add an orderable guideline. So that's in the bottom left, clicking that add orderable. So basically the difference here is this personalized orderables it allows you to add a single guideline at a time. So the previous screen that we were looking at, that's applying a condition as a whole. This is allowing you to just pick out one guideline. So maybe the whole list of guidelines don't really apply. But for this particular patient, like in this example, maybe a BMI adult follow-up. So maybe that BMI is higher than we'd like it to be, and we really want to track that and maybe look at some diet and exercise plans or whatever the case may be. We can add that particular guideline. This is just to this patient for this one guideline. It will default the interval, start age, stop age based on the setup, but that can be modified for this particular patient as needed. And then finally, our last kind of option, and again, this is all at the patient level, is we can add reminders in our care guidelines. So that's that second blue link there for the add update reminders. And really the difference here is this reminder is just a free text field. So it's not linked back to any care guideline that's in the system. It's not linked to an order, a specific test, a medication, anything like that. This is really just to, if you'd like to use care guidelines, kind of as a to-do list or a reminder. Like in this example, we put like discuss birth control options further. So, maybe that was something that the patient was considering, but, decided to hold off. And so maybe at the next annual visit, you want to bring that up because, that's something that the patient maybe wants to discuss or, reevaluate their options. So again, it's just free text. These won't auto-complete because there's nothing set up on the back end to tell them to auto-complete. You would put a due date associated with that. So, in that example of birth control, maybe you'd put a year from now for that when it would come due. There's that add task button, so you can actually create a task associated with that as well. So if you kind of want the two places, so it's going to be sent as a task to your inbox as well as something in the care guidelines. And again, these would just create kind of a personalized list of reminders that again aren't necessarily associated with a specific test or recommended care that out of the box. You have the ability to set these up for patients as needed. All right, and then obviously setting up the care guidelines is good. Auto apply, manual. But probably if I would say there's one issue that I see the most and work the most with clients on, it is completing care guidelines. So there are quite a few ways that these can be completed. And again, I would say if this is an area you are struggling with, I always recommend look back at your configuration. The first and kind of the recommended, really the way it should function, I should say, is autocomplete. So when orders are placed, if something's documented in the chart, if you have the latest version and now documents can complete guidelines for you, or certain check marks or fields within the documentation. The goal is really for this not to become a manual, you're manually having to mark every guideline as complete. So I'd say if that is something you are personally struggling with at your practice, go back to that configuration, make sure it's set up correctly. With that being said, there will be times maybe when a guideline needs to be manually marked as complete. So to do that, you would click in that status field and select completed. And then you also have the ability to place an order directly from the care guidelines window. So that check mark to the left of the order, like for example, breast MRI, I can check that. It's going to open up a pop-up for the orders module, and I can place that order. And then once that's has been placed, then it will mark that guideline as complete. So with that being said, we have a few other options of some instances where it might be valid that you are having to manually mark things as complete. So it's kind of out of the ordinary, something different has happened. So the first is, and again, all of these, I'm clicking in that status box, that blue arrow, and choosing from the list. So besides completed, we have performed elsewhere. So this can be used if a certain test, maybe it's a guideline that comes up, that it's not something that you would ever order in-house or, actually have a result come in. So it's not going to autocomplete. Or maybe it is, and the patient just went to a different practice and had it done, or is transferring into your care. So they've already had, for example, like a mammogram or a pap smear done previously. So obviously we won't have an order. So when I click that performed elsewhere, it's going to give me my historical test pop-up. I can add the details if it's appropriate, like in that example of, they went to a different practice and you have a historical entry. Otherwise, if you don't have that data to historically enter it, and I just say, okay, it's going to mark this guideline as performed elsewhere and fall off as no longer due. We also have an option here under status for declined. So we have declined and declined permanent. So there may be an instance where a patient chooses not to have a certain test done or receive a certain immunization or whatever the case may be. So that's something that shouldn't still stick around on the list. It's just going to clutter things. So we can either choose declined if it's just kind of a one-off, or even decline permanent. So if that's something that a test or screening or immunization they're never going to receive, again, that will have that fall off the list of what is due. We also have an option for excluding guidelines. So again, kind of like declining, we have our two options, so excluded or exclude permanently. So this would allow you to basically, if a guideline does not apply for a particular patient, then I can go in and I can mark them either as excluded just for the one time, and then it would become due in the future, or exclude permanently. When I choose those options, I will get a pop-up that has this exclusions and measures, and I will need to add in the details of basically, why this patient would be excluded in this particular case. Another option that we have for our status, again, clicking that blue arrow next to the status box, is hold testing. So basically this allows you to defer the due date of a care guideline. So I would come in here and I would select hold testing, and then it's going to give me a pop-up calendar, and I can choose whatever future date that I would like. So whether that be, a month, couple of months, year, whatever the case. And then it will show, as you can see here, resume testing on, and then whatever future date I selected. So a good example I can think of for this, if maybe there is a certain guideline, and a patient is currently pregnant, so that particular test would not apply, or a certain immunization or anything like that. So you want to choose maybe that patient's due date, and then those guidelines will become due again on that future date. So it allows you to not have them just hanging out there looking like it's something that's not being addressed, but allows you to address that then when the time is appropriate in the future. And then finally, I wanted to go over some options for removing care guidelines from patients. So in the beginning, Holland talked about that care guidelines, remove and restore template. That's obviously at the practice level. There are some options to remove at the patient level. Again, this is something that hopefully shouldn't have to be done too often if they are applied correctly. Hopefully we don't have a lot of duplicates. If you are seeing, there's like 5 PAP guidelines being applied for every patient that need to be removed, again, I would just recommend look at that configuration and see what's going on. But basically, we can remove guidelines either by condition or individual guidelines by clicking that Add Update button. We can also restore individual guidelines. So if you've removed one previously, but now it applies, again, in that Add Update, you would look at that Active Guidelines panel and then click Add, and it would re-add it back to the patient. As well as those reminders, we can go back into the Add Update Reminders button, or link, I should say, and we can remove a reminder if it's no longer applicable or is on the wrong patient or something along those lines. Okay, so hopefully you have a little better idea of the workflow and kind of how care guidelines can function in your system. I wanted to, before we wrap up and move on to questions for today, I wanted to look at some additional ways that care guidelines can be used for your practice, and some additional options that you do have. So the first item that I want to look at is reporting for care guidelines. This is probably a pretty common one that I receive. So the instructions that I'm going to review kind of quickly here today which is a note, we always send out the slides. So you will have these step-by-step. So if you're going in the future to, go and set up this report, you will have these to reference. But these options that I'm reviewing for allowing you to kind of track those care guidelines and see what's due for your patient population, this would apply if you are on version 592.842 or higher. So with that version, they changed the reporting a little bit to be a stored procedure. So if you are on an older version, then you would add the care guideline template set under the templates tab. So it will kind of be more of a traditional way of, if you are familiar with reporting on templates in EHR, that's how you would do it if you are on one of those older versions. That being said, if you are on 592.842 or higher, you would go to the SP, which stands for Stored Procedure tab of the EHR report writer. You check off Stored Procedure up there at the top, and then built into your system, pre-installed, so nothing you should have to do, there should be a Care Guidelines Stored Procedure. We'll have to set up a few filters. So we will go through and select Enterprise ID under the Enterprise ID column, Practice ID under the Practice ID column. And no, that's not a trick. It is as simple as just matching those two up. And then you'll have to type in the exact guideline name in that guideline name column. So a couple of things I want to point out with this report. First, it does at this time have to be run separately for each guideline. So, if you try to put in multiple guideline names, like with commas or something like that, you will get a blank report. Also, the name has to be an exact match. So that's something important that if you look under that system practice template, you can see exactly how you, named it. For example, PAP versus PAP smear. It's that specific in order to have the results come up. There's some additional reporting options under the columns tabs. You can do things like add, remove columns, filter by, a certain population set, and then you would click OK. And then here's an example of, I ran a report for PAP. So this is telling me the list of patients that have the PAP that is either currently due or past due. And then finally, real quick, because even though Lindsay's not presenting, she's still on today, she would cry if we didn't talk about MIPS. So we did just want to touch on how care guidelines can kind of be a useful tool for those of you who report under MIPS. So care guidelines weren't really designed specifically to help you meet MIPS measures. That being said, however, they're still a great tool to help with facilitating compliance with those measures. So, if you're really struggling with compliance with, required testing or screenings that need to be done in order to meet MIPS measures, you can set up care guidelines to kind of be a sort of to-do list for your practitioners, which should increase performance and, what the ultimate goal is to lead to those, better clinical outcomes for your patients. So some examples of ways we've seen care guidelines used specifically to MIPS are things like the diabetes eye exam, BMI screenings, and that hemoglobin A1C testing. All right, so with all of that said, we've reached the end. I know we're very close to the end of time, but we will turn it over for questions, but hopefully you have kind of a better understanding of care guidelines. And like I said, my biggest last takeaway is if you are really struggling as a practice, if you are thinking these are cumbersome, not useful, go back to your configuration, because that's usually where I see issues. And if they're not set up right, then yes, it can be a bear, but otherwise it can be a great clinical decision tool and help for your practitioners.
Okay, all right, I am going to go ahead and take it over for questions. I also want to point out that you have our contact information here on the screen. There's Lexi and myself, and then even Lindsay, if the MIPS slide really prompted a question for you, I'm sure she'd love to hear it. So let's go ahead and get started with questions. I know that we got asked a lot about whether or not the slides were going to be sent out. There will be a slide and recording sent out, so I just want to make that known again. I know Lexi mentioned it, but everyone will be receiving the slides today. But let's get going here. When we set up our own care guideline and there is an update to care guidelines, are our care guidelines wiped out and we have to rebuild them?
Yeah, so Holland, I can take this one. So that's a great question and one I get a lot. So I'm going to say the answer is if you are coming from a version that previously you had Care Guidelines 1.0, and now you are going to Care Guidelines 2.0, which, as Holland mentioned, it's kind of the default now, but wasn't in the past. It wasn't always required. There is a brand new configuration template. So I would say that theoretically, your configuration should move over, but that would be my biggest concern. If you are coming from a version where you already had Care Guidelines 2.0, then no, there shouldn't be any need to rebuild. And all of those, interval changes that you've made, any of the, patient-specific changes you've made should still exist. I will just say, kind of an anecdotal experience, I'm working with a group that is upgrading and they're coming from Care Guidelines 1.0 to 2.0 with their upgrade, and they did not experience any issues with that. So again, theoretically, no, but there are ways to back up your Care Guidelines, like for example in SQL, and I would highly recommend that if you are upgrading. So if you are NextGen Direct, they can help you with that or give you some guidance. Otherwise, if you have someone who is familiar with SQL, I would definitely recommend that backup. Just always better, safe than sorry.
Awesome, thanks, Lexi. Do the guidelines look at birth sex or current gender?
Yeah, so I can grab this one as well. That's a great question, probably something we should have specified from the beginning, but yeah, so yeah, because we always get that question. So currently the Care Guidelines are looking at birth sex. I know what probably the response to that is going to be, if it's the patient's current gender, that may be a little more appropriate. I will say the last that I looked, there was an idea out on the success community if you wanted to vote on that for that to be updated, but current state looks at the patient's birth sex.
Great, thanks. What diagnosis code do you use in order to activate the FQHC guidelines?
So assuming that this question you're referring to, I mentioned, there's now those FQHC, CHC guidelines. So basically you would just select, either if you're applying them at the patient or the practice level, you would select the condition of CHC, FQHC, UDS guidelines. And then you are correct, it's going to ask you to associate a diagnosis code with that. Unfortunately, I can't really answer that question because it's more of a, for the back end for orders and things like that, more on the billing end. But I would say just a diagnosis code, probably typically I would say like one of those general screening ones probably would apply. But again, I can't give you an exact answer because that is a little more related to billing for your individual practice.
All right, next one here. Is this a standalone template? We are not upgrading until October, but wondering if we can add this prior.
Yeah, so that's a great question. So there is the Care Guidelines 2.0, which is a lot of the functionality that we were talking about today, is still technically offered. The last I checked, I'm going to say that because that's my little caveat there, because I know they are getting away from it being standalone. But the last I checked, it was available for the past couple of versions. So like if you are on maybe one of the more recent ones, like a 5.9 2020.1, or maybe even like a 5.9.3.8.4.3, potentially back that far, you potentially would be able to get the standalone template. But I do know that they are getting away from that, and that will be going away at some point in the future. So I would say that if this is something you'd like to add now before you upgrade, I wowould open up either, so if you're NextGen Direct, go to your account manager and see if that is possible. If you are one of our clients, then you can reach out to us and double check. But I would say last I checked, that was possible for certain versions, but I do know that's going away because they're just kind of lumping it into the upgrade as a whole.
All right, I do see a question on here about asking, if there's the ability to run reports off of the Care Guidelines. I'm assuming that one came in before just there. Lexi snuck that information there at the end. But yes, you can run reports, with that Care Guideline information. And again, we're going to send out the slides so you'll have those recommended report parameters sent out to you and easily accessible to you. All right, let's see what else we have here. You showed us the metrics panel. Are these metrics set out of the box, or do we customize this list?
So those metrics are set out of the box. So they are based on some kind of the common lab tests, vital signs, things like that, that are associated with those conditions. But yeah, that's a great question.
All right, and I do want to say we did get a couple questions that are, just a little bit more specific than things that we can answer over the phone. So I don't know, Lexi, if you want to jump in and try to kind of provide some more recommendations on that, but there are certain circumstances in which it might just be best to reach out to like NextGen support or, whoever your lead contact is there, that they can kind of assist you in answering those questions.
Yeah, definitely. I think that's great advice. And like I said, really just looking at your configuration if you are struggling and just seeing if things are lined up correctly. Especially, I feel like there's a lot of issues, if those intervals need to be customized for your practice, or a lot of times what I'll see is, in that the setup template where you have the ability to set up like alternative names and tests, test equivalents. Like let's say if you work with a particular lab and they use a different test code, that's usually where I see the issues, especially if things aren't completing like you think they should. It's either a matter of the naming of the test or the codes. You don't have everything listed there, that it's not up to date, as maybe you started working with a different lab, or maybe LabCorp changed the values that they accept. Those are kind of some initial things. And then, as Holland mentioned, at the bottom of that setup template, there is an FAQ section, and that really does a good job of kind of going over some of the common things, I would say, that issues that I've heard or things not working quite right. They do kind of address a lot of those in that section. So hopefully that can help guide you, or as Holland said, if NextGen support, or if you work with us, reaching out to us, and we would definitely be able to go in, but it does require us kind of looking at your specific configuration.
Awesome, thank you, Lexi. We did get one last one kind of squeak in here, but we have done a lot of configuration of care guidelines for peds and health maintenance adults. We did not do a full cleanup and removal of care guidelines first. Now that we have customized and applied, we find that we have to remove and reapply to many patients individually. If we now do the cleanup and off hours, will it apply our new ones or out of the box care guidelines?
Okay, I think I somehow closed out of the question window. So I think I gathered that. I don't know how to get back. So yeah, I think I'm understanding. Basically, if you were to reapply, like using the care guidelines, it would apply when you're applying them from the setup template. It would apply those custom templates. So as long as the changes were made, and then you go in and apply them to your patient population, it should apply the whatever set up in that template. So if you have them customized, that's what that should apply. Yeah, hopefully that answers your question.
All right, and I think that was the last of our questions. Lexi, we got the confirmation you did answer the question.
Awesome.
We love that. But again, you have our contact information up here on the screen. If there's anything that comes to mind, if you want to reach out, we're happy to help. And thank you all for joining today, and we look forward to seeing you on our future webinars.
Thank you, everyone. And just a reminder to keep your eyes out for a new name and emails, because we're going to be starting to reach out to you as DAS Health. So thank you for joining us today.
Thank you, everyone.